Hi, my name is Pat Dowling. 56 years old, and I've been treated by Dr. Chen for the last probably 23 years. To be honest with you, I don't really remember how I started coming here. I believe it was I have Dupuytren syndrome in both hands, and I believe I was being treated on my left hand 20-some years ago. So the first experience, I believe I had some injections in my left hand for the Dupuytren syndrome, which they worked, but they were just, I felt they were just, it was very painful when he straightened my hands, and the procedure didn't last that long. But I guess around that time, I had a chainsaw accident, and I was up in the tree, and I ended up cutting my wrist. And as I climbed down the tree, I lost I could feel everything that worked my fingers shooting up into my elbow. And went to the emergency room. I came here because I was familiar with Dr. Chen, and they immediately did surgery on my hand, and they surgically attached it, everything to my finger so they would work again. And I'll never forget this. You know, Dr. Chen's it's kind of a dry sense of humor, and 2 weeks later, after the surgery, I went to see him, and he took the bandage off, or the cast off, and he says, "Can you move your pinky?" And my middle finger moved. "And can you move your pointer finger?" And my index finger moved. I was like, almost got a migraine headache. And I said to him, I says, "What, did you screw up the operation?" He says, he laughed, and he said, "What do you think? There's a color code? You know, blue is your pointer finger and orange is your middle finger?" He says, "Your brain will teach your hand to work again." And sitting here today, I have a full functioning hand, and I think he's probably the best doctor around, in my opinion. Sure, well, like I said before, I have a very aggressive form of Dupuytren syndrome in both hands. Most recently, he operated on my left hand, and my fingers, my pinky, my ring finger, and my index finger were basically at almost 90-degree angles, almost touching my palm. So I only had really, two fingers that were really working in my left hand, and I let it go way too long. Probably 10 years I lived this way. And Dr. Chen operated on my hand, and the end result was, I have hands that open and close, and again, I think he really is a great doctor. One of the best things is Dr. Chen moves his patients along. So if you're in a waiting room, I've never been in the waiting room for Dr. Chen more than 20 minutes. That's great. I really liked coming to the surgery center here. It's downstairs from the office on the first floor. It was very organized. Went in. I was sat in the waiting room for 10 minutes before I was being prepped for surgery. The staff was friendly. Everything went really well. The best part is, I don't know what he does, but I've had probably 4 surgeries on both hands, all completed by Dr. Chen. And I'll be honest with you, the biggest fear was that I was going to lose the feeling in my fingertips, or have nerve damage, and I never had any nerve damage. And when I left the operating room, I guess he numbs you up or something. So I really had zero pain. I had Tylenol afterwards, and there was no need for any narcotics. And I came to see him like a week later, or I took the stitches out. It just was a very relaxed atmosphere. So the post-surgery, I got operated on February 24th. So we're sitting here maybe, 5 or 6 weeks after surgery. My hand is completely healed. The scar tissue is down. I did go for therapy for 5 weeks, and little by little, everything's coming back. But the therapy definitely helped. Yes, I would. most definitely, especially Dr. Chen. Thanks, Dr. Chen.